I'm Executive Director Kevin Robertson, and this is the KDA Video Minute for Friday, January 13th. This edition of the KDA Video Minute is brought to you by the KDA Association Health Plan, providing group health insurance for member dentists and their staff statewide through Blue Cross and Blue Shield of Kansas and Kansas City. Contact Dennis Maggart at McGinnis Group for more information on the KDA Association Health Plan. Well, Happy New Year to everyone. If you saw my last Video Minute, hey, I guess those games didn't go so well, so we're just going to move right into 2023 today. Hey, Kansas Legislature kicked off on Monday earlier this week, so both the House and Senate are ramping up. The KDA does have some priority items that we're working on this year. So really the four main things are these. First of all, a bill that has to do with prior authorization. We're working with our other healthcare provider friends in the medical community to put forth a bill collectively. So that's going forward. That bill also will include some aspects of what we call retroactive denial, meaning when you're paid by that insurance company and then they come back later and say, oh no, we overpaid you or we shouldn't have paid you. So that's a piece of that prior authorization bill. We'll also then have a bill that will have to do with medical loss ratio. That is very similar to what just passed out in Massachusetts with their ballot initiative. So we'll be working on that. We'll be working on some non-covered services issues that we have put forth before. Of course, Kansas has legislation with regard to non-covered services with insurance. However, we've been trying to work to kind of tweak and change the definition a little bit so that maximum benefit is covered, or once maximum benefit has been reached, then that patient will be non-covered within the definition. So those are things we're working on. Now, the other thing that we are working on that's very important is we are working with the American Dental Services Organization to make some changes to the 20% rule. So what we're looking at is that 20% rule that requires an owner to be in a satellite practice, a satellite office, at least 20% of the time that dentistry is being performed. We're looking to remove that rule. We're the only state in the country that has something like that, to be quite frank with you, and then replace it with some other language that then guarantees that patient is protected as far as their quality of care and what's going on. So we're working with on that issue as well. So you'll be hearing more about those four things as we move forward this legislative session. We've included a link of the KDA legislative priorities on the e-news today. So if you'd like more information on our legislative priorities, take a look there and give us a call at the KDA if there's any other information that you'd like. Of course, talking about the legislative session, Dental Day will be Thursday, February 2nd. That'll start at the Capitol itself this year in the Visitor Center. So we'll ask our dentists and everyone who attends to park in the visitor parking lot, or at least find a spot on the street on the north side of the Capitol. We'll come into the Capitol, meet at the Visitor Center before we start meeting with our legislators. Lunch will still be across the street at the Beacon, our legislative luncheon that we have. So look forward to you all being involved in that. I will tell you, those of you that do come into town for that early morning, because of the restrictions on food in the Capitol and in the room that we'll be in, we will have coffee available, but we won't have breakfast rolls and breakfast like we have in the past. So just be aware of that. If you plan to attend Dental Day, you should have already received some information on that, a postcard in the mail, and also you can find registration available online at the KDA website. Now, last week we did a text messaging message that came out from the KDA office. It was just to alert everyone that we've implemented that alert system through text messaging through the legislative session. So if anything comes up where, gosh, we really need our members to get in touch with legislators, important issues because votes are coming up, we'll let you know via text message. So that did go out to about half our members that we have good cell phone numbers for and had signed up for. We're not going to overdo it. Be aware of that. And if we do get a message, I hope that you will participate and make those contacts as we move forward during the legislative session. As you know, the Kansas Mission of Mercy will be in Topeka March 24th and 25th. Registration for volunteers will open on February 6th, so be watching for that. We look forward to you participating. This year's Kansas Mission of Mercy will be a full clinic. So the last couple of years through COVID, we kind of had a half-size clinic. We're going to have all the chairs. We're going to need all the volunteers, particularly those dentists, dental assistants, and dental personnel that we can get to make sure that that clinic is running smoothly. So watch for that. Please participate. Love to have you. And especially exciting this year is we will be celebrating our 20th anniversary of the Kansas Mission of Mercy. Hard to believe, back in 2003 we were out in the snow in Garden City, but we've come a long way 20 years later. Please be around to help us celebrate. As we get past to the first of the year here, remember that your 2023 KDA and ADA dues are due now. We will be implementing, along with the American Dental Association, a March 31st cutoff or deadline of dues. In the past, we've kind of carried members throughout the year and continue to try to get their dues. We want you to stay involved and be a member. However, as of March 31, you will be moved to a non-member status. So let's get that taken care of as soon as possible, and love to have you stay with the KDA and be a committed member throughout the year. I want to remind everyone that Children's Dental Health Month is coming up in February, so we've been working on implementing the programs to help our schools throughout the state. If you need posters for your office or would like any type of materials for your office, or to take perhaps on school visits, as you might be invited to talk to some local schools during Children's Dental Health Month, you can find those on a link that's contained in the e-news. So go to that link and then you can fill out that information and we will get those materials to you. And please be involved, and let's spread the word of good oral health to our students and across the state of Kansas. Thank you for your attention today. That wraps this edition of the KDA Video Minute.